Okay, so now let's quickly go through the causes of the ascites. Basically, the causes of the ascites, this is a question which is usually asked in the rounds in the medical wards. Basically, every person in the medical ward usually have the ascites, and then the professor somehow manages a way to ask something that you can't really think of. So just memorize, after going through this video, hopefully you will memorize all of the causes of the ascites. So let's go through them. So ascites, I didn't know what else to come into my mind, but just the S. So just memorize this, that this is going to help you with the ascites. So this is our sketch. So basically our doctor is stealing liver and heart. So you can see our lovely doctor here stealing those things. So this is through his S. So this is going to help you the various different causes of the ascites. Now starting with the cause number 1, the first and foremost cause is the portal hypertension, which is the most common cause. So this is going to help you remember the portal hypertension, this porter that the S is dragging along. Now in this porter you can see the first and foremost structure is liver. Now the liver cirrhosis causes portal hypertension. Now this cirrhosis could be due to any reason. It could be viral, it could be alcoholic, which is the most common in the UK. It could be non-alcoholic, so I won't get into the details of that. There is a separate video on the causes of the cirrhosis which you can learn. So for now, just remember that the first and foremost cause of the portal hypertension of the ascites is the portal hypertension, and that portal hypertension usually is due to the liver cirrhosis. Along with that, you can also see the heart. So basically the right-sided heart failure, which lead to the congestive hepatopathy, can also cause the portal hypertension, which can lead to the ascites. Along with that, you have the constrictive pericarditis, again congestive hepatopathy, again lead to the portal hypertension, leads to ascites. As you can see that this porter contains various different veins type structures. So these veins are going to help you memorize that. These veins is going to help you memorize that Budd-Chiari syndrome, which is basically the obstruction of the hepatic vein, the thrombosis of the hepatic vein. So that can also lead to the ascites. Along with that, you can see that the heart as well as the liver are insisted in this. So this is going to help you memorize the schistosomiasis, which is one of the infection which can also cause the portal hypertension, and that can lead to the ascites. It's a very rare cause, but just to keep in mind. So portal hypertension is one of the cause of the ascites, and portal hypertension is in turn caused by the hepatic cirrhosis or Budd-Chiari syndrome, pericarditis or congestive hepatopathy, and schistosomiasis. Okay, the next thing that can also cause the ascites is basically hypoalbuminemia. So hypoalbuminemia, whenever there is less protein within your blood, it will lead to the third spacing of the fluid, and that can occur in the periphery or it can occur in the abdomen, which then lead to the ascites. So the first and foremost thing, you can see that our donkey is carrying this kidney shape locket. So this is going to help you memorize the nephrotic syndrome. So whenever the patient is losing it through the urine. Also you can see the donkey dung. So that is going to help you memorize the protein losing enteropathy. So you are losing protein through urine, you are losing protein through intestine, or you're not eating enough protein, which is in the case of the severe malnutrition. So that can also cause the ascites. Okay, so portal hypertension, hypoalbuminemia. The next cause could be, as you can see, our lovely doctor is carrying a tube. So that tube is going to help you memorize tuberculosis, which is one of the infection, and it is very common in the subcontinent and those areas. So anyone from those areas, do keep tuberculosis in mind. The next are the malignancies. So the malignancy, you can see our lean thin person here, and he has this spider, which is our recurrent symbol for the cancer. So this cancer crab on this patient abdomen. So basically any peritoneal cancers can cause it, along with the peritoneal cancers. You know, it could be primary peritoneal mesothelioma, or could be peritoneal carcinomatosis, which usually occur from the gastric, ovarian, or colon cancer. Also, if it is a female, then you can also think of the Meek syndrome, which is basically when there is a benign ovarian tumor, and along with that you have ascites and pleural effusion. So that constellation of symptoms lead to is called as the Meek syndrome. So far now we had portal hypertension, hypoalbuminemia causes, and malignancies. Then along with that we have the other causes, which are miscellaneous causes. Now miscellaneous causes are very rare, but just keep in mind that there are lots of ducts within the abdomen, and any of those ducts, if they are ruptured, so what happens is that the fluid spill and then it leads to the ascites, development of those ascites. Say for example there is pancreatic duct, so if that is damaged by any way, it could lead to the pancreatic duct leak, and then lead to the pancreatic ascites. And the same is the case with the biliary duct. So if the bile is leaked, that can lead to the ascites. If there is a lymphatic duct going down, if that is damaged by any way, it can lead to the lymphatic duct obstruction, or it can lead to the lymphatic ascites. Along with that, if there is any surgery, that can lead to the destruction of any of those ducts, and that can lead to the ascites. So these trees in the background, which are very rare causes, is going to help you memorize those ducts, and that can lead to the ascites. So just now hopefully you will have now mastered the causes of the ascites. So basically, number one is your portal hypertension, that is usually caused by the cirrhosis, myocarditis, right-sided heart failure, or constrictive pericarditis, the Budd-Chiari syndrome, the schistosomiasis, then hypoalbuminemia, which is caused by the protein-losing enteropathy, nephrotic syndrome, or very severe malnutrition. Then you have infections such as tuberculosis, you have primary peritoneal cancers, you have lymphomas, you have other cancers that have the peritoneal peritoneal involvement in them, that can lead to the ascites. And finally you had miscellaneous causes due to the rupture of the ducts within the abdomen, that leads to the leakage of those stuff. So hopefully by now you would have memorized the various different causes of the ascites, and hopefully now on the word rounds you can tell all of these causes by heart. Okay, thank you. See you in the next video.